What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor & Home. After tearing up your old carpet, they'll vacuum and apply Healthinex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor & Home goes the extra mile to protect you, your family, and your home. Carpet One Floor & Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, April the 26th. Good to have you with us today. We've got a couple of dentists here. One has been missing for several trips now because she was busy having a baby. Dr. Elizabeth Abe, welcome back from Columbia Healthy Smiles.
Thank you.
And, of course, Dr. Philip Batson.
Thanks for having us.
New dad,
Yeah.
the 2 months old, the baby's 2 months old now, 3 months old?
Almost 2 months, yes.
Yeah. So how are you doing?
Okay.
Good. I was hoping that the baby would come down and pay us a visit today. But anyway, it's good to have you back again.
Thank you.
Last time, Philip, when you were on,
Yes.
we were talking about the different myths of dental hygiene. And we went through, let me pull these up. We talked about the myth of bleeding gums, that bleeding gums are normal, which is not true. We talked about the myth that sugar causes cavities. That was an interesting story. Brushing harder cleans better, which is not good. Flossing is really not necessary. It is necessary. And chewing gum works like brushing your teeth. Those were all the myths that we covered last time. I thought we'd start here today with another one. Is white teeth means that you have healthy teeth. Is that true or false?
It's kind of a misnomer. People can see somebody with a bright white smile and think there's nothing wrong with their teeth and think they have, beautiful teeth. But that's only showing a small portion of their teeth. It also doesn't show what's in the tissue of the tooth. There's very well could be cavities, that don't show up, through a nice bright white smile. Our teeth also, as we age, our teeth naturally aren't as white as we age. They get some more gray tones and yellow tones, so that is a natural part of aging, and it doesn't mean they're unhealthy. It just means it's an aging process.
Right.
But having beautiful white teeth is a great thing too, but it doesn't necessarily equate to them being healthy teeth.
Okay, so keep that in mind. Just because you have sparkling white teeth does not mean that they are healthy. You need to go to the dentist. Another myth is charcoal toothpaste is better for you than regular toothpaste. I'd not heard of charcoal toothpaste. What is it?
So typically it's that toothpaste that has that darker gray appearance, looks like charcoal as well, but it tends to be more abrasive, so that is something to keep in mind, especially if you have sensitivity. It's often advertised as making your teeth whiter, and it's because of those abrasive ingredients in it, and it's usually not recommended by us because we prefer that you don't use abrasive toothpaste because that can damage your enamel over time as well.
Okay, so charcoal toothpaste actually has charcoal in it?
That is what they claim, yes.
Okay, and what it is, think of it then, if I'm interpreting you correctly, it's almost like taking a Brillo pad on your teeth and trying to whiten them that way.
Right. Correct.
So you don't want to use abrasive toothpaste.
Yes.
So that is a myth that charcoal toothpaste is better. Now, here's another myth. This is myth number 8. It says kids don't need to brush their baby teeth. True or false?
That's definitely false.
Why? Okay. Yeah. If the baby teeth are going to fall out,
Yep.
and they're going to fall out within a year or so, what is the necessity of having to brush the baby teeth?
And that's a great question because we get this asked by parents a lot. But actually, the baby teeth, are the first ones will come in around age 6, and some of those baby teeth we need to stay in the child's mouth until they're 12 or 13 years old. 12 is about the age when you lose your last baby tooth, and you lose some baby tooth around age 8, as well. But what those baby teeth are doing, they're holding space for the adult teeth. You lose those baby teeth early, your space can start to close and cause crowding long term. It can, create development issues for the adult teeth, which are the ones we're really trying to look ahead to. So, and it also creates a good habit of oral hygiene in that child. If they don't care for their baby teeth, how is that going to translate to them caring for their adult teeth, which are the ones that you get your first adult tooth around age 6. It's a molar that you get, and we always say that tooth we want to be in that patient's mouth, when they're 6 and then when they're 96, and so.
The first adult tooth comes in when you're 6 years old?
Yeah.
The first baby teeth start coming in when?
Around 6 months.
6 months?
Yeah.
Are you saying then you should start brushing those baby teeth at 6 months old?
Yeah, and so you don't necessarily have to go in with a toothbrush right away, but just in the early stages when they have 2, 3, 4 teeth, they can take a wet washcloth and just wipe away, wipe any sugars that were on from, either breast milk or once they start with some of that solid food feeding, just to wipe anything that's on the teeth away. And then you can graduate to some really soft brushes that just massage the gums a little bit, and it helps the gums as those babies are cutting their teeth in, as those teeth are coming in. And then you can move on as they get a little bit older to a regular toothbrush, and it's really about just instilling that habit of good oral care for the teeth, because that'll translate then to their adult teeth.
Okay, all right. So it's a good habit to get into for the young people.
Absolutely.
The next myth is loss of enamel causes sensitivity. Now, to me, that would make sense. If you're losing your enamel, your teeth are become more sensitive. But is that a myth or not?
It definitely is a possibility, but there's other factors too. Some people they don't have as much of a nerve system in some of their teeth, and so sometimes even if they've lost a lot of enamel, they aren't sensitive. And then others, the slightest bit of enamel loss, and it is very sensitive. So I would say that it's a myth, but also there's truth to it.
Okay,
as well.
All right. Next one's a little bit tricky. Gum disease. If you have gum disease, you only need to be concerned about it in your mouth, not the rest of your body. True or false?
False. I mean, you do need to be concerned about it for your mouth, but for the rest of your body, we always say the mouth is the gateway to the body. You have bacteria that can travel through the bloodstream. It can be an indicator for cardiovascular disease, diabetes as well. There are indicators in the mouth for diabetes, and it has a big, people with cardiovascular disease, heart disease, things to keep an eye out for.
All right,
that.
so you need to keep that in mind. The bottom line is take care of your mouth. It takes care of the rest of your body.
Yeah.
And if you have any questions at all, we're out of time, and there were still more questions there. But if you have any questions, you haven't been to a dentist for a long time, you really need to go. You can give them a call at Columbia Healthy Smiles. There's no pain involved. And what's your phone number?
573-875-7071.
Okay, and if you're lucky, you might even see the new baby when you pop in there. Hey, guys, thank you so much for coming by. It's a pleasure seeing you. Okay? Something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu, and have yourself a nice day. Bye-bye.